Clinical Assessment and Planning Nursing Care, Session 5, Deep Tendon Reflexes. How fast are you? When doing deep tendon reflexes, remember to hold the reflex hammer lightly between your thumb and index finger and to use your wrist to tap the tendon briskly with a quick bouncy motion. Some tendons are easier to strike with the pointed end of the hammer, while others with the flat end. With practice, you will develop a technique of your own, and remember that the patient must be relaxed for you to be able to elicit the reflexes. Distracting the patient with a task or a question that requires some thought is often helpful. Biceps in the upper arm, C5 and C6. The biceps reflex is elicited by placing your thumb on the biceps tendon and striking your thumb with the reflex hammer and observing the arm movement. Brachioradialis, C6. The brachioradialis reflex is observed by striking the brachioradialis tendon directly with the hammer when the patient's arm is resting. Strike the tendon roughly 3 inches above the wrist and note the reflex supination. Repeat and compare to the other arm. Triceps C7 and 8. The triceps reflex is measured by striking the triceps tendon directly with the hammer while holding the patient's arm with your other hand. The patella, L3 of the lumbar. With the lower leg hanging freely off the edge of the bench, the knee jerk is tested by striking the quadriceps tendon directly with the reflex hammer. The Achilles, which is S1 and S2 of the sacral area. The ankle reflex is elicited by holding the relaxed foot with one hand and striking the Achilles tendon with the hammer and noting plantar flexion. Babinski reflex. The plantar reflex, or Babinski, is tested by coarsely running a key or the end of the reflex hammer up the lateral aspect of the foot from the heel to the big toe. The normal reflex is toe flexion. If the toes extend and separate, this is an abnormal finding called a positive Babinski sign. The reflex scale. Naught means absent reflex. A +1 trace or seen only with reinforcement. A +2 is normal. +3 is brisk. A +4 is non-sustained clonus, repetitive vibratory movements. And 5+ is sustained clonus.